My name is Crispin Afifu. I work with the International Center for Research on Women. ICRW, together with a number of other stakeholders, including the State Department for Gender, UN Women, we have been working tirelessly for the past 3 years to be able to develop the national care policy. It is almost coming to fruition because right now it's at the cabinet. And in that policy, this is what is going to transform the economy of this country. One, it's going to ensure that care is adequately measured because what you cannot measure, you cannot reward. Yet we know from other studies that indeed care contributes so much to the economy. So it's time that we consider this, and so that policy is coming in to do exactly that. This policy as well, it is what is going to professionalize how care is being provided and who's the people that do provide care. So it's about recognition, it's about rewarding them and ensuring that their voice and agency is actually on the table where decisions are being made. Another thing I want to say about this policy is that it has come at the time that we as a country need to recognize that the caregivers ought to be included in social protection benefits that are being offered because they are doing a very important role, which actually should be done by the government. And so when you look at the care, what we normally call as the care diamond, we have the role of government, we have the role of families, we have the role of communities, and even CSOs and the private sector. And in all this, you realize the families have been doing their bit, and even the CSOs. But of course, the private sector and government, at times they have been a bit of lagging because they maybe were not very much aware of the importance of supporting or investing in care and care infrastructure. Now, on the side of government, we want to commend the efforts that are being put in place, that of developing this policy, among other policy frameworks that will be related. I think as I come close to this, I want to say that for us to win together, we need as many partners on board. So it's time to break the silos, be able to link research to action, and of course the different programs that have to be put in place by different actors. So care cuts across to the young, to the old, the PWDs, the sick, everyone else needs care. And of course there's how we provide, how we experience it, and now it's time to recognize it in our GDP. And beyond that, our final call, and this is what is going to be made possible by this policy, is to establish what we call a national, within the national system of accounts, we're going to have a satellite account that we actually really value and budget for care. And because we know care is being provided at all layers, but there is a big responsibility by the county governments. And so this policy also tries to show that there is a role that the national government will do, but also there's a bigger role for the county governments to do. So how to sync all that and to have proper regulations, standards implemented across is what we must put our efforts into.